the quadratus lumborum is a muscle in the lower back. It is irregular and quadrilateral in shape, and broader below than above. Structure: it originates from the lower border of the last rib for about half its length, and by 4 small tendons from the apices of the transverse processes of the upper 4 lumbar vertebrae. It inserts via aponeurotic fibers into the iliac lumbar ligament and the internal lip of the iliac crest for about 5 cm. Occasionally a second portion of this muscle is found in front of the preceding. It arises from the upper borders of the transverse processes of the lower 3 or 4 lumbar vertebra, and is inserted into the lower margin of the last rib. Relations: anterior to the quadratus lumborum are the colon, the kidney, the psoas major and psoas minor, and the diaphragm. Between the fascia and the muscle are the 12th thoracic, ilioinguinal, and iliopogastric nerves. Variations: the number of attachments to the vertebra and the extent of its attachment to the last rib vary. Functions: the quadratus lumborum can perform 4 actions: lateral flexion of vertebral column, with ipsilateral contraction, extension of lumbar vertebral column, with bilateral contraction, fixes the 12th rib during forced expiration, elevates the ilium, with ipsilateral contraction. Clinical significance: back pain. The quadratus lumborum, or QL, is a common source of lower back pain. Because the QL connects the pelvis to the spine and is therefore capable of extending the lower back when contracting bilaterally, the 2 QLs pick up the slack, as it were, when the lower fibers of the erector spinae are weak or inhibited. Given their comparable mechanical disadvantage, constant contraction while seated can overuse the QLs, resulting in muscle fatigue. A constantly contracted QL, like any other muscle, will experience decreased blood flow, and, in time, adhesions in the muscle and fascia may develop, the end point of which is muscle spasm. This chain of events can be and often is accelerated by kyphosis, which is invariably accompanied by rounded shoulders, both of which place greater stress on the QLs by shifting body weight forward, forcing the erector spinae, QLs, multifidi, and especially the levator scapulae to work harder in both seated and standing positions to maintain an erect torso and neck. The experience of productive pain, or pleasure by a patient upon palpation of the QL is indicative of such a condition. Hip abduction is performed primarily by the hip abductors. When the gluteus medius minimus are weak or inhibited, the TFL or QL will compensate by becoming the prime mover. The most impaired movement pattern of hip abduction is when the QL initiates the movement, which results in hip hiking during swing phase of gait. Hip hiking places excessive side bending compressive stresses on the lumbar segments. Thus, a tight QL may be another hidden cause of low back pain. When the hip adductors are tight or hypertonic, their antagonist may experience reciprocal inhibition. The gluteus medius will become weak and inhibited. This in turn may cause hypertonicity of ipsilateral QL. Chronic hypertonicity of QL tends to cause low back pain due to its ability to create compressive stress on lumbar segment. Current studies show that application of heat or ice, massage, and STIM will not leave long-term benefits. Careful assessment of muscular imbalances and movement impairments by a therapist is recommended in order to address the underlying issues mentioned. While stretching and strengthening the QL are indicated for unilateral lower back pain, heat or ice applications as well as massage should be considered as part of any comprehensive rehabilitation regimen. Additional images. References: this article incorporates text from a public domain edition of Gray's Anatomy. External links: Origin, Insertion and Nerve Supply of the Muscle at Loyola University Chicago Stritch School of Medicine, -1,234,501,552 at Notebook, Quadratus plus Lumborum plus Muscle at E-Medicine Dictionary, Atlas Image, Abdo Wall 70 at the University of Michigan Health System Posterior abdominal wall, dissection, anterior view.